Assalamu alaikum. Welcome back. As I have promised you yesterday that we will study about the bishop score. So, regarding the bishop scoring, it's about whenever we admit some patient for spontaneous labor, we have to calculate the patient. Either patient is having a good bishop score, she can be admitted for the spontaneous labor or not. Bishop score is mainly a method which decides that this patient will go into the labor smoothly. Like as time of spontaneous labor approaches, cervix is becoming more soft and shortened, and it is moving forward and it start to dilate. Three things happens: it is shortened, it is dilated, and it is becoming shorter. And in the normal preparation of labor, this process is nearly complete. Induction process will lead longer if bishop is poor. In mid-90s, syntocinon oxytocin, famously used drug, it became available, and intravenous injection and rupture of membrane was indicated, and then the procedure of the labor was started. Now mainly you have to understand about the modified bishop score. In modified bishop score, there are five things that you have to observe. Number one is dilatation of the cervix. Number two is consistency of the cervix, length of the cervix, and the position of the cervix and station of the presenting part. Now the dilatation of the cervix, you have to see either it is dilated or not. If it is not dilated, you will give the 0 score. If it is 1 to 2 cm dilated, you will give 1 score. If it is 3 to 4 cm dilated, you will give 2 score. And if it is more than 5 cm dilated, you will give a score 3. Now about the consistency of the cervix. Cervix is, if it is firm and hard and all around it is very stiff and you cannot reach the internal os, then bishop score is 0. If it is medium, then you give 1 score. If it is soft, you give 2 score. And if it is a little bit dilated, its consistency is that you can feel the internal os, you can give the score 3. Now the length of the cervix, when the process of the labor starts, cervical length is decreased. So if the length of the cervix is more than 2 cm, then its score is 0. But if it is 2 to 1 cm, then its score is 1. And if it is 1 to 0.5, its score is 2. And when the length becomes more shorter, 0.5 cm, then score becomes more good. It's 3. Position also gives the indication that whether labor is processing good or not. If cervix is posterior, then score is 0. If it is central, then score is 1. If it is anterior, then score is 2. Now the station of presenting part is the main important thing. If the station is -3, score is 0. Station is at -2, then score is 1. Station is at -1 or 0, then it is 2. And if it is below the spine, then it is 3. But the most common formulation that is currently used nowadays, previously as I told you, syntocinon was used, now prostaglandins are available. So they are used as a part of induction of labor. A controlled release of pessary is also available, and prostaglandins are recommended even when the cervix is favorable. Cervix may ensure that the prostaglandin, and by artificial rupture of membrane, and then the infusion of oxytocin, these all factors will help in the progress of normal labor. That I will discuss later on. Mifepristone, like misoprostol, estimom, cytotec, commonly used drugs. These can also be used as the induction of labor, but it has its own complications. It's rarely used now. Membrane sweeping sometimes helps, but insertion of the gloved finger through the cervix by rotation through its cervical wall, it helps sometimes and release the natural prostaglandins, as artificial PGE2 prostaglandins are also available. But unfortunately, sometimes it doesn't help. And I will teach you the process of induction of labor. and then normal labor in the next lecture. Hope you have understand the Bishop score today very well, and if any questions you can ask me. And for next topic you can also tell me about the topic which you want to ask, and inshallah see you next time. And continue like and subscribe my channel, and we will have a healthy discussion on other topics. See you next time. Okay, Allah Hafiz.